Oh, my buttons are. In this area of the country, it's, Minnesota, Wisconsin. It's a beautiful day, 31 degrees out, very sunny and calm. Do on a day like today, if you have 5 minutes, is go outside, take a deep breath, relax, and just be happy. Then go to work, take care of your kids, of course, first. Give them a big hug before they go to school, always important. Yeah, I'm all done with that by now. My kids are old, old, old. They're making their own kids. Well, my daughter isn't yet, but I would like her to. But don't. I hope she's not watching this. I don't want to push the wheels a little bit. So shoulder pain. Oh, I do want to mention, if there's next thing, we'll mention it again next week. We're going to talk about foot pain and a number of things that go along with that to help you out, from plantar fasciitis to bunions, etc. A lot of simple things you can do to keep your feet healthy. That is a big one. I've learned a lot about that in the last year, particularly with a podiatrist we've worked with, Dr. McClanahan. Excellent, excellent podiatrist. We've learned a lot of cute little tricks and handy ones. So, anyways, I think there was a question about his shoulder. Was there something, Tanner? Oh, here we go. Coming up. I think we're going 3 minutes to countdown for the real show. Now we're just talking about other things. Oh, now I do want to talk about shoulder pain. If you're really working with some shoulder pain, that's just that naggy pain. You want to find out, does it hurt when you go up like this consistently, or up and then on the way down, oh, it hurts right here, but then it feels good down here, or it hurts here and it feels okay once you get up here. That's called what'd you say? Yeah, painful arc syndrome. I'm sorry, there's a little interruption there, but that painful arc syndrome, it's a very good chance you got a mild impingement problem, and we're going to talk about that in the first 1 or 2 minutes of this program. It's called Hanging. It's by Dr. Kirsch. He's an orthopedic surgeon. Well, he's retired now, but he came up with a whole system, and he taught that and worked with that with his patients, and he decreased the number of surgeries on his shoulder he's had by a great deal, which really saved his patients a lot of hardship, and it worked out quite well. We're going to talk about a simple little technique called hanging or brachiating. It's very simple. We'll talk about that a little bit more. Mike, you got anything else? Oh, Bob is here. Bob, we're still doing our countdown. People are coming in, and what's going on? Bob, look, Bob's happy. That's good. We got him. Give me a thumbs up if you hear me, Bob. There he is. Okay, everything is good. So, well, anyways, let's go. We're going to talk about a couple other things. Oh my goodness. Oh, the Booyah stick. Yeah, you don't need a Booyah stick, but we'll talk about some treatment with your shoulder with a simple device like this 4 or 5 foot long stick. It's got to be a little strength to it, and it'll work really well for getting not only impingement, but shoulders, and it actually works down into the low back and some possible hip because it's all connected. Talk about depressed scapula, where the scapula actually moves down a half an inch or so, changing mechanics of the shoulder, and you get neck pain and headache just because the scapula is moved a little bit, and that can be from posture or things of that nature that have accumulated over years of sitting in front of a computer workstation with this kind of posture. Oh, don't worry about that. It's just Tanner walking in front there. All right. How's everything going, guys?
I think we're almost ready.
We're almost ready.
Is my mic working?
Check.
Now?
1, 2,
Hello?
3. We're just doing a few
Hello? Or did I turn myself off?
technical things. Oh, hello. Okay, there we go. Foster D.
Bob and Brad, the two most famous physical therapists on the
Maybe you don't want
internet.
us to give us your last name, but that's all right. Oh, here we go.
Hello.
Oh, there I am, right
Can you hear
on the
me now?
screen. Things are
Okay.
going good.
I'm here too. Don't worry.
Yes.
Although people
Glenella,
probably just
hello.
want to see Brad.
You know, if you could put where you're from, there we go.
And now we're live.
I don't know if
on
I can pronounce the name from Florida, but Jacksonville, Florida, Assassinina. I don't know. I really apologize. I do not think I pronounced that properly. Okay. Yeah, put where you're from. We like to know where people are coming in from, what location. It's always
Brad.
nice to know how this
I'm bad with
World
names,
Wide
too.
Web can really help us out all across the world. So, anyways, Mike, welcome back.
Oh,
Thank you for all your hard work trying to get everything connected up, and our camera people and everything. There's quite a
we have
web
a very
of.
grumpy laptop.
Oh, we have a little. We had actually like 10 minutes before we came on, we had no internet service to this area. So we were on pins and needles, and everyone's a little bit nervous. I said, settle down, naturally, because I don't have anything to do with it. I just get to sit here and talk. But they worked hard, and now we do have some internet service. Things are going well. Hopefully it will not cut out. I do want to mention next week at 10 minutes to 10 Central Time, we're going to talk about, look at that, the foot. That's why I'm wearing my Red Sox, so they stick out when we do mention that. So if you have any problems with your feet, plantar fasciitis, bunions, pain, etc., that'll be the topic next week, Tuesday, 10 minutes to 10.
We got a lot of hellos. Linda, hello from Tennessee.
There
Lancaster, Pennsylvania. Michelle, Honey 8 Studios is in Sacramento. We got Janet from Michigan. Michigan's pretty. What part of Michigan? Well, northern Michigan.
Oh, Yooper, good. I like the Yoopers. Maybe
India,
they don't like that.
Santosh from India.
When are we going to get going on the first thing?
We can get going right now. Hello from Omaha. The first tip. So we're going to go to over 20 shoulder tips, 20. Mm-hmm. And the first one is hanging. Brad, do you want to take it away?
Yeah, actually, if you were here a few minutes ago, I talked about this from Dr. Kirsch. There's actually a nice book with it. Right here, he's got a number of versions, but you can purchase this book. It's pretty inexpensive, about $10 online. Dr. John M. Kirsch. So the primary crux of it is actually brachiating or hanging. So on a pull-up bar, or we're using the hanging handles, modified ones here, but you don't. All you need is something you can hang on, all your body weight, and you just don't grab it and put all your body weight on. That's not the proper way. When we do hanging for the shoulder, what happens is it opens a space up so that your supraspinatus tendon does not get impinged, causing your pain. So we're going to, Mike is going to show that in a little bit, but here we go. It works really well if the bar or your handles are close enough to the wall. Oh, now
here's the supraspinatus tendon. It has nice pink tape there. If not enough room, it can pinch in there, right on your shoulder blade there, and it kind of hurts. So what we're doing is stretching out.
Pretend my finger's a tendon.
Wow.
Ow! See? That's how I give it an analogy.
Well, it has nice pink tape, but if you want to smash your fingers, go for it.
Well, that way you can actually feel it and get a good interpretation of what's going on in there.
So what we're doing is called hanging, or some people call a dead hang. No one's actually dying, but you just simply let your shoulders stretch out.
Right. And as I mentioned before, we're going back and forth. Put your back up against the wall if you can. That's the best way to do it, but you don't have to. But the big thing is when you grab the handles or the bar, you're still standing. And we're going to slowly, with good control, put some weight through our arms. You feel a stretch, then you can stop. You're going to hold it there 15 to 30 seconds. Now, a little bit of pain is okay. You've got to read this properly. Don't overdo it, but you still want some stretch. So I do this on a regular basis for maintenance. I've had shoulder impingement and very successful using this treatment. And I'll go down. I'm about 50% weight bearing right now. And that's probably where a lot of people will start, holding it 15 to 30 seconds. After you do this for a while, you can hold it for a couple minutes. I actually only go about 30 seconds now in my maintenance program. But as you do it, it should feel like a nice stretch. Hold it, and I'm actually hanging now, and I'm comfortable. Things feel good. It's good decompression on your spine as well. If you have some other injury that is irritating, make sure you do not do it. But that's the basic concept of hanging. We're going through it pretty quickly, I'm saying. So there, it should feel good when you're done and afterwards. The first time you do it, don't spend a lot of time on it. Do it for 15, 20 seconds once or twice, and then see how you respond for the rest of the day. If you come back the next day, it feels good, that would be the green light to go a little bit longer, and each day you can go more than that. So again, this little book here is written for the lay person as well as the therapist. Some of it you may not understand as a lay person, but most of it, he does explain thoroughly how to go through it, set up your own system. Mike, you look anxious.
You're talking a lot. So I'm going on to the next
sorry.
exercise. So we have a couple shoulder questions already. One
Ooh.
person cannot raise their arm above 30 degrees in a certain position. The other one has trouble lifting weights without their elbows bent. A lot of these exercises or stretching we're showing, you can certainly try with any of these issues. Just do what you can with your range of motion and see what feels the best for you. They're not all going to work, but feel free to try them out because shoulders are kind of complicated.
Right. And I think what Mike's got the stick there, you can do an early version of this hanging with a stick and just start to get range of motion. So this would be
the affected arm here. So what I'm doing is working on flexion or bringing my arm straight up. Most people have more problems going straight ahead or far out to the side. So if you kind of go in between here, we'll say it's roughly 30 to 45 degrees. Most people are better moving their shoulder that way, have more luck moving their shoulder that way. So oftentimes if you can't lift it up, what I'm doing is using my good arm to help lift my bad arm up like this. Just go to what you comfortably can and do 10 repetitions or so. If you want, you can also try doing it overhand grip like this and going this way. However, this is takes a little bit more muscle activation. So for this one, you can also try it laying down on your bed. You can use a cane, a broom handle, pool cue, golf club, whatever you have available. But now, if you look, gravity is actually assisting me with stretching, going down like this, and I'm holding onto this stick, so I'm not activating that shoulder as much. For camera's sake, I'll go this way. For my right shoulder, we'll say this is a painful one. You can also do it this way, but it's the same motion. So we're just trying to work on that overhead flexion and get it stretched out a little bit.
Jabari from Omaha, how are you doing? Nice to hear from you. Boy, we've got a lot of people that are asking questions, so it's hard to get everyone.
I'm going to get into the next tip, and then maybe we can answer.
Okay, very good.
Ones. So the next one, since I'm holding this stick, is working on extension or bringing your shoulder back behind you like this. Most people, this doesn't bother too much because you're not going overhead, but it's good to work this range of motion as well. So if my right side is bothering me, imagine like you're canoeing and you're paddling and just push back. Now, we're not going to go in a weird circular motion like a paddle. You're just going to push back into shoulder extension. Feel a good stretch like that, and then you can relax and just try to work on that range of motion as well. And it's a good stretch to do your shoulder. This is a McKinsey technique, isn't it, Brad?
Yes, yes, that is. And I do
McKinsey.
That one on a regular basis for maintenance as well. It can be really effective.
Brad is really close to the screen trying to read the questions right now, but he's here.
Trying to move it.
You can't move it. Danny has to move it. Do you want him to move it?
Right there. Hold it.
So you want to read? Oh, he's reading.
Right. Julia. She's actually from Winona, Minnesota. I've heard of that town. Now in the Bahamas. I guess that would be a good trade.
To raise at 30 degrees.
And actually, if that's the case, 30 degrees, I'm assuming we're talking, right, Julia, about to here. I think you could.
Palm facing the body. Cannot raise more than
I think you could use this and actually work this technique, Julia, and see how it feels. Now, this is the other thing that you went through, flexion, right?
Yeah.
I would work with that. Flexion. And then, you can use the stick for pre-hanging. Did you talk about that?
We're going that later, but you can do it now.
Yeah, I'm going to help Julia out. If you have a stick, again, can you take your shoe off? You can use a pool cue.
I already talked about that stuff.
Oh, okay. But you can use this for the same treatment as hanging, and it's a good way to pre-do it so it's not too aggressive. Grab, hold, and then drop your body weight and stretch this out. Again, be careful with this one. It should not irritate it. Maybe a little pain, but not too much. If it just feels like it's sharp knife-like pain, it's not ready for it. Definitely the wrong thing.
Now, you can do it seated as well. You don't have to
Oh,
stand.
that's a good point.
So if you feel more comfortable doing it seated, you can just do it seated and lean over. Raising from the side, not front or back. Oh, she's saying abduction.
Oh.
So yeah, you would just bring your arm out to your side then. It's the same concept, and just do what you can for motion, and then you can kind of lean into it. You can even do tabletop like you are right now.
Yeah, just slide into
Go
it.
sideways.
Did we tell why we had the shoe off?
It's so the stick doesn't go out and move around. Yeah, we're just taking shoes off.
People are wondering what we're doing.
In case you have a normal broom handle that slides around on a smooth countertop or tabletop, a shoe will keep it in place for you.
Right. All right.
But another option for Julia is just to do a tabletop slide, but go sideways instead of forward. So that way you're working on your abduction with a little more motion. A lot of people feel pretty comfortable with that.
Yeah, a cute little trick is take a little soft ball so you don't have to slide it across the table and roll it.
Or a towel if your tabletop's sticky or something. You can do that as well.
Yep. Oh, boy, a lot of things to talk about. So we'll continue to do the best we can.
Is it okay for small tear of the supraspinatus? You can try any of these, just don't push it too much because it's going to bother your tear in your rotator cuff tendon more. So just do what's comfortable. Let it calm down before you get too aggressive with your rehab with
right.
So
We're going to go the internal rotation with the belt. This is a nice little trick.
So if you are struggling to reach behind your back, whether it's putting on a shirt, reaching in your back pocket, or maybe your coat, and you can't, one side you can get up really high, and the other side you're stuck kind of down here by your belt line, what you can do is take a rolled up towel, a bed sheet, a belt loop like this, and all I'm going to do is put it in my wrist in the little loop like this, and then my other hand is up here. So all I'm going to do is pull up, and notice once I pull up, I'm stretching into more motion. Now, most people will feel a little bit of pain or discomfort, so just go to where you can, and you're going to hold this for a stretch for like 30 seconds and do it 2 different times. So just go here. If you can get up comfortably, that's fine, but just go where your motion feels more comfortable. And over time, each week, just kind of test out and see where your one shoulder is in comparison to the other. Because most of the time, especially after, like, say you had surgery and you're struggling with this, oftentimes people are stuck here. And then within like a month or 2, they're kind of more up to here. They may not be perfectly even, but they've made a lot of progress.
Right. Be careful with this one when you bring it up. Again, gentle, just a gentle stretch. We're not going anywhere that's going to produce sharp pain. That means you're pulling the tissue apart and possibly ripping it. So
if you've had a lot of shoulder dislocations too, this one may be a little touchy there.
I did want to mention to Donna, she talked about hurting her shoulder from hanging with all of her weight. So again, as I instructed here, you really want to be careful on gentle, graduated weight through their arms, and it should only be not sharp, no sharp pain at all, gentle, just a stretch, and a little bit the first couple times to see how your shoulder responds. Sometimes it feels okay at first, and this goes with all of our exercises, but then the next day it gets sore, and then you say, oh, I must have overdid it. So really be gentle and careful, cautious, good judgment the first day you do a new exercise. What's next, Mike?
I was just reading someone started doing that belt stretch yesterday. So
oh, really? See, we had a patient who was scheduled for shoulder surgery, did that stretch, again, cautiously initially, but within a couple of weeks, her shoulder was much better, canceled the surgery.
Next one is working on arm flexion with repositioning. What do we mean by that? Elevate the arm while adjusting the humeral. Oh, we're talking about arm slides on the wall, I believe.
Yeah.
There we go.
There's 2 different options. This is a mulligan technique. You can do it on a table or with a stick, and sometimes the humeral head drops down inferiorly or down towards the floor. And if you grab a stick here, and I'm going to push my hand down like that, so I'm pushing while I maintain the grip, and then we're trying to get this motion, and it hurts. But if you do this and you pull down, that depresses the humeral head into the socket where it needs to be. Then you bow or walk backwards, And as long as it's pain-free, you're doing good, because right now I'm actually in the same range if I go up like that. So you can do that exercise, come back up, pushing down towards the floor. Okay. And that can be one of those little tricks that can pay big dividends. Again, this hurts, but when you do this and walk back, no pain, then you would continue to do it. No pain while you do that. And that'll translate into pain-free flexion back to normal in time.
So you can do that at a countertop too. Obviously, this is a little low, but if you're standing up, I'm just putting weight through my hands. Obviously, it would be taller than this. And then I walk backwards as I'm pushing down. So it's the same concept. You don't have to do both hands. I just like to do both hands because it's fun. And just go down to what you comfortably can and then back up. You can also do it in a seated position, but Brad just stole my stool. So I don't know
you can take
it. Now with this one, you need something that can slide so you can push the weight down. So my hands are staying in the same place and then my butt's just sliding back. You can do this in a computer chair as well, but you can go forward slides. The problem is you can't push down hard enough to do a forward slide with this. So for this technique, you kind of have to just keep your hands in place and move your body. But you can just do, typically we do like 10 repetitions with this, right, Brad?
Right. Yeah, no more than 10. You know, especially the first time, you may want to start at 5 and see how it responds the next day. If it's good, go up to 10. Good question.
We do have a question from the Halographic Mind. So 67 years old, suffering from sarcopenia, which means muscle loss.
Yep.
I wonder if my condition is causing a painful, crampy feeling in my posterior delt. So that's back of the shoulder for everyone listening. That ties into those smaller support muscles along the scapula. I mean, to a point, but you can just try strengthening your posterior delt and scapular muscles more, especially if you have sarcopenia issues. So
I think number 8 would actually be an option for her.
Yeah, it'd be really good. So we'll get to that in a few exercises. We'll let you know.
Yep. So just hold on, and we've got a nice exercise for that.
We've also got some pull aparts too that really.
Oh yeah.
Our next one is kind of a similar concept to what we just did. Our next tip, we are on tip number 6, but it's using a wall instead. So can I just move these real quick?
Sure.
So you can do whatever motion is problematic for you. These are just called arm slides. Some people like to slide their arms. Some people go palms facing the wall. Some people go more of a neutral position and work on elevating, like our friend Rick Olderman, and do wall slides this way. I've also had other people just do finger ladders. So they kind of crawl their fingers up the wall, or spider crawls, we call this sometimes as well. Whatever way is most comfortable for you. But the whole idea is the wall is assisting you with your motion that you're struggling with. So if it's just straight flexion like this, you just go straight ahead. If you struggle more out to the side, then you would go sideways, and you can go up this way as well. Do you want me to use a ball?
Yeah, it's a nice little trick. And a lot of people have a ball around the house. They got the neighbor kids.
Yeah, you can kind of just roll on the ball. Now my hand's not really staying on it. I kind of end up going to my forearm a little bit, but you can just roll that way into it as well. Or did you mean ball on the wall and doing circles?
Well, that one too, but for range of motion, you know, that using the ball, it just eliminates the friction of sliding. And you can do it facing forward for flexion.
And if your walls are kind of grippy, you can use a towel.
Sure.
On your forearms as well. But yeah, just go what motion feels good. Now with our friend Rick's, if you kind of have a depressed shoulder blade, you think, what you can do is when you go up is you actually shrug a little bit to help clear your scapula more within your shoulder joint, and it can help with that depressed scapula. Typically, we just do 10 repetitions. You can do single arm if you want, or both arms, whatever's comfortable for you. Oh, I'm running out of breath. What's the next tip?
Well, we do want to talk about if you have some real shoulder pain where it hurts so much, it hurts to do anything, just to move it. You're not doing anything. It's hard to sleep on it. We need to actually calm it down. A good way to do that is with a cold pack. Let's say you fell, you slipped and landed on your elbow. All the force went into the shoulder and possibly dislocated it, went back in, stretched out and painful. Get a cold pack, and you're going to get a cold pack that's flexible so that when it comes out of the freezer, it wraps right around and makes contact on that shoulder. I like to do this. I had a lot of patients. We get in a soft, comfortable chair, a recliner. We don't have one here for that. And then just lie back and let that cold pack settle on her for 15 to 20 minutes to get that acute swelling out of her. The injury just happened. You're going to do this for at least a couple of days. Once it feels better in the inflammation, you feel like it start to move a little more, it's not so sore, it might be time to change over into heat to get the circulation going and get it loosened up so that you can start to move it. And to do that, you could take some of these cold packs are actually made to be hot and cold. Put it in the microwave as prescribed by the directions on the hot pack or cold pack, and then you have a nice warm pack that lasts. If you want to have more time, because these will cool down, it's best probably to get an electric one. Mike's showing one right there that does the neck and both shoulders. This is a weighted hot pack, which I am a big proponent of because they just work better. The weight pulls down and makes contact. There we go. And it gets, these are just nice. I've used this one for my back, shoulders. I've used it on my chest when I had a chest cold. I've used it on my legs, and they're just wonderful. Go ahead, Mike. I'm babbling.
This is actually our shorter one. We have a longer one that goes down to your mid back as well, but it's hiding in the other room right now. You can use any type of hot pack. This is an electrical one we have available at Bob and Brad. Now, if you're finding this works for you well, you can keep using this. However, if you want something that penetrates a little bit deeper, things like Thermatex, which is a far infrared heating system, will penetrate a lot deeper. However, these are quite spendy, so just keep that in mind when looking at them. But if you find heat very beneficial, some people really like investing in one of these. Brad, do you have anything else to add about heat? Heat, now I would say if you have a rotator cuff tear that's been there for a while, or you have arthritis in your shoulder, it can be pretty beneficial. Like Brad mentioned earlier, if it's something acute, like you just injured your shoulder, ice is going to be your friend for a while.
Right. And you don't have a hot pack, you can simply take a shower. Let the warm water go over the
Or if you have
shoulder.
a hot tub, but that's more expensive than all these. But it's pretty beneficial and fun.
Yeah, so heat it up in the shower. Get your clothes on, obviously, then go out and do some exercises while it's nice and relaxed and loose. You do need to, again, be cautious. Don't overdo the exercises because when it's warm, it might feel good and you overstretch it. So just do them at a moderate pace, not a real aggressive stretching or strengthening.
How can I help pain from LTN damage? What's LTN? Labral tear? I don't know what LTN is.
Yeah.
Cheryl,
Sorry.
what's LTN? Just clarify for us so we can help. Thank you. Anyway, let's get on to number 8, which was, who was that woman earlier? Mid-trap strengthening.
Yeah, she was having.
Oh, right there. The hollow. Sorry, down, Danny. The halographic mind. So this is going to strengthen your mid-trap muscles, which connect to your scapula in the middle. Oftentimes, people are kind of weak in this general area from poor posture and being excessively rounded. So we're going to show you kind of a 4-step progression you can try from our friend Rick Olderman, who is a physical therapist. I just have to move my mic back so I'm not laying on it. So for beginners, all you work on doing is squeezing your shoulder blade. So if it's my right one, I'm going to try to talk without the mic going in this pillow here. You lay face forward. You can put the pillow more overhead. I have to hold up for my microphone. But the first thing you're going to do is I'm just going to leave my hand sitting on the table. And I'm just going to squeeze my shoulder blade like this towards center. I'm going to hold it for roughly 5 to 10 seconds. And then I'm going to relax down. And this is all you're going to do for level 1. You're just going to squeeze that shoulder blade and then go back down. Now, the next tip, what we're going to do is actually lift your palm off the mat, but you're just going to go a little bit. So what you can try to do is just lift up a little and then back down. So you're going to hold that for roughly 5-10 seconds and do it 10 times. Now, if you want to start getting a little more advanced, you can put your palm up towards the ceiling, do the same thing, or you can start working your arm out to the side more and really work on it. And if you do 10 sets of 10-second holds, your arm, I can really feel my shoulder blade like starting to activate quite a bit. It's starting to work. So, and you can also go out to the side more like this. So just kind of vary where you start. Again, beginner, leave the palm on. More advanced, start lifting it off and then start messing with your angles that you're holding it at.
And for Ann, she's asking if it's okay to use light dumbbells. Should she wait to finish physical therapy first? Well, if you're in physical therapy, your therapist should be able to direct you when you should start using dumbbells to the exercise. This exercise here, you could eventually go to dumbbells after you get through the fourth one. I don't have a shoulder problem
They
there,
have
but
tendinitis. So tendinitis, as long as you're not too painful and inflamed,
yeah,
you can start. Usually early on, you want to hold off on weights and just work on motion. And then usually they'll start giving you resistance bands or dumbbells once your pain subsides more.
Yeah. It's one of those judgment things. Learn your body. If it's doing it and it irritates it, makes it painful, it's too soon. Wait till you can progress to that. So
I barely did anything. My mid trap is like cramping on me.
Yeah,
that's a simple exercise for how much it really isolates that area.
Right. Yeah, and that's a good example. He didn't use any weights, and he worked his muscles in that area, and he's in shape with
I do a lot of rowing stuff, but I don't do a lot of isometric holding in that duration.
Right.
So it's just something different. Cheryl says, long thoracic nerve was LTN. Do you have anything for long thoracic?
No, I don't, because that one it's hard to make general statements without a little more detail. So I'm gonna
there's nerve glides, but other than that, there's not a whole lot. I don't even know what could help with that.
Right. That's not enough information for me to give any confident information. Sorry about that. Cross fiber massage to the subacromial area.
That's our next tip number 9. So what we're kind of talking about is some of the tendons in your shoulder area. Typically it's in the front, located there, or even on the sides, depending upon your painful area. So some of it Brad's kind of showing is typically over there. If you happen to have like more front shoulder pain, it's probably your bicep tendon if it's in here, but this can also work for that issue as well. So what you can do for just anyone is just take your fingers like we're doing, and then you can either double them up like this, or if you have really good strong grip, you can just put them side by side. But you're really going to dig in there, and it gets a little uncomfortable. And you may do this anywhere from 2 to 5 minutes. And it's called cross fiber friction massage. But what it does is it brings a lot of blood flow to the area, which carries nutrients, can help it heal faster. So depending upon your pain area, just do that. If you happen to have some type of massage tool or massage gun, you can also use that in those areas as well.
Let me just go a little bit deeper in the explanation that when you're doing this, it's actually breaking up scar tissue as well, which can be helpful. And also, here's a red flag. If you're doing it, it kind of hurts at first. And after about 30 seconds, and watch a clock too, or look at it. After 30 seconds, it starts to feel better or kind of numbish or cold, but better. That's a good sign. Then you keep working it. But after 30 seconds, you're going on it, and it's like just getting more sore and more irritated. Red flag. It's not ready for cross fiber yet. It has to feel better after that 30-second mark. So again, my fingers are starting to get sore, and they will, because you're pushing in, you're getting in deep. And that's where, if you have a massage gun, we have a couple ways that you can really get into it. You're going to have to use the round head.
I don't have the round head on right now, but I'm also not super irritated in my shoulder at the moment, so I'm okay. This is the C2 Pro. Brad has a Q2. The Q2 Pro only comes in black. The only difference between a normal and a Pro is the Pro have a hot and cold head, and the regular models do not come with that. But Brad's kind of showing with the soft round head how you would cross fiber. He's not going directly on it. He's going at an angle.
This is how you do not do it. That'll just beat it up and irritate it. You go sideways, so you get that cross friction movement, because the head's moving about 7 millimeters back and forth, and it really works well. I've used this myself. Had patients use it. This is one of those things that just feels good. If you're really tender and it's irritating, again, it's not ready for it yet. Now, with the hot cold head, if you happen to have, and I've had this where you get that strain in your pec muscle right in here, and that point, there's a lot more, especially if you're muscular like Mike, you can get in there, and you do want to get in a little more direct. You can use that hot cold head. Go ahead, Mike. You
Yeah,
can
so it has a
demonstrate
couple
that.
of heat settings, a couple cold settings. Just pick what feels good to you. You actually have to charge the head separate, so if it's not working, you just have to charge it up. But yeah, if you want to get into the pec region, often people with shoulder issues have tight pecs as well. So you can just you can hear my voice vibrating now, but just kind of get into that area that's being problematic. And I like to kind of mess around with where my arm is, because if it's more forward, I'm hitting different muscle fibers than I am when it's back more. So you can just kind of see where it may be feeling tight and work that region. You can also go into the bicep region as well if you're having radiating pain down that way with this.
Right. The other thing you can do effectively with the massage gun, now the supraspinatus muscle, you get the pain here where the tendon is, but the muscle belly is back here. And that muscle belly can knot up and get tight, putting strain on that tendon. So if you get back here and you work that and loosen that muscle up, can make a big difference on that nagging pain. Feels good. Just one little thing. If you're going back here, don't use one of these massage guns up on your neck. That's not a good idea. Keep it down on the shoulder area and over that muscle, which is
Sabrina
in this
says hi
area.
from Ohio. I'm saying hi.
Oh,
Sorry, I didn't mean to
great.
interrupt
How you doing, Sabrina? Sabrina Young, very good.
That
Ohio.
area gets sore when I do flies after not having done them for a while. Oh yeah, your pec region. Yeah, if you're doing flies, what you can try to do is just go not go back as far and go way back like this, depending upon if you're doing them with just a dumbbell on a bench, or if you're doing, sometimes the machines are a little better because you can lock them at forward positions more, so you don't get quite as sore if you're doing that. But it's still good to stretch back into it as long as it's pain free. I can't read that one, Danny, because you're hovering over it. The cold feeling tip was one of the best things I learned about from effectiveness. Mood boost to achieve that. Oh, good.
Now, I do want to back up a little bit. For some of the people, again, you're in that phase where your shoulder just is painful, and you find yourself throughout the day that if you grab your arm like this and just rest it by support of the other arm, it feels good. That's a very strong indication you'll be benefit from using a sling. You can use anything for a sling. You can simply go out and buy one. I'm going to use actually one of these bands. Actually work pretty good.
Fortunately, our towels are too short, but there's a lot of homemade sling videos online just using a towel and folding it.
Yep. Yeah. So, and then what you'll do is work with your arm. Say you're working throughout the day, your shoulders are getting fatigued. Then just put it in the sling for, a half hour, an hour to give it time to rest. And then it may be okay to work with it again. Or it may be time to leave it in the sling for the rest of the day, depending on your injury and pain level. But again, anytime you feel like you're doing this, taking the weight off, get a sling, so that way you still have this hand you can work with, particularly if you're on a desk.
It is good to take it out of the sling from time to time, just because it will start pulling on your neck and causing a lot of tension in your neck, which leads to your shoulder as well. Anyone that's had rotator cuff surgery and has to wear a sling can attest to that, which I see a lot of right now. Our next tip is towel or throw pillow under your while sleeping. Okay.
Yeah, this is big.
So, if you're having some shoulder pain while sleeping, I've had some people after rotator cuff surgery and they can discharge their sling, still sleep in their sling because they don't like their arm flopping all over the place. Plus, they feel like they're going to wreck it because they don't always know what they're doing in the middle of the night. So that's an option. However, if you don't have a sling, we can show you a couple different ways you can position yourself if Bradley would come back here with my pillows.
Whoa!
Thank you.
Whoa!
So if you are a back sleeper, what you can try and do is just get some support. So first off, you can just try some lateral support. So it's up like this. Most people feel more comfortable if their elbow is bent and like here. So you may need a couple pillows you can mess around with. If it's a throw pillow, a big pillow, but just getting it some nice support like this, often people feel more comfortable. If you are a side sleeper, there's a couple different techniques you can try. Most of the time, we recommend you have your painful side up top like this. Notice if I have a few pillows here, I need to fold this up. I got big shoulders. If I have my arm like this, it's nice and supported then. However, some people can only sleep on one side and say that's my left side. What you can try and do is take a pillow and you're going to place it kind of by your ribs here. So you're going to make a little canal. And with this little canal, you're going to have a little gap for your shoulder to rest in. And most of the time, you're not going to be directly on it like this. You're going to be a little back like this. And then this can feel good as well. Stomach sleepers, you're going to kind of struggle. I'm sorry. I don't have many tips for stomach sleepers and shoulder pain. Most of the time, it's not too bad if you just... But those are a couple tips for sleeping positions with shoulder pain.
Okay, Nell, she broke her collarbone or clavicle about 3 months ago, and she is still has pain with restricted movement. That is a situation without, just over the internet like this with description of the injury, which I've fractured both my collarbones. It's going to take a while, but you may have to see a physical therapist in person because you definitely want to get it moving, but it needs to be done appropriately so you don't overdo it and take a step backwards. So,
oftentimes it's important to work on your motion first before doing resistance training. As long as your motion's good, then I would say any type of strengthening that is below 90 degrees. So 90 degrees is just even with your shoulder. So anything in front, side, extension, or rotation down here is probably fine. It's normally when you start doing those overhead things, if you're having a lot of pain yet, especially with the clavicle fracture, it can be problematic. If you're healed up and you're allowed to go overhead, I would start with just wall slides like we showed earlier to get overhead. You can even do ball on wall. Brad, do you want to show that? So actually doing like circles.
Yeah. Oh, we're on me? Okay, yeah. Again, you really need to be careful with this. If the doctor said no precautions, do what's tolerated, then this would be a good thing to do, but don't overdo it. Just a little, especially the first day, you can go straight ahead. Well, let's say the left one, work until, a little pain, that's enough. A little pain, do that 5 or 10 times. Then go out to the side. Again, this may take over a couple weeks before you can get up to here without any pain, but that's okay. Take your time. Using a stick is a good thing as well. We talked about this earlier. Just to get that shoulder moving in a good, respectable, pain-free range, taking time. No sharp pain. You don't want to rip anything apart and take a step back. So again, if you're having real problems with that, see if you can see a therapist again, right directly on face-to-face. What else we got?
I was reading an interesting comment about someone talked about a weighted vest, but most weighted vests don't include the shoulder, and I don't know how you would strengthen your shoulder unless you're doing, push-ups, you would get some anterior, and if you did handstand push-ups, you would get shoulder, but you're not going to get a lot of shoulder strengthening from that. Your traps have to hold it in place, but I don't really know what else. You're not going to isolate the shoulder a whole lot with just wearing a weighted vest.
No, I agree. I think that probably would, except for some certain special cases.
Use a weighted vest if it's not bothering your shoulder. It's fine.
Sure.
It makes everything more challenging and tiresome. What's our next tip?
We want to stretch the shoulder back.
Oh, yeah. So if you're a person with anteriorly rolled shoulders or your forward posture, we both go into it like this. What we want to do is stretch the opposite direction. So we're going to let gravity help with this. Now, do you want to show without a foam roller first? Because
sure.
Some people are very tight. If you need to, you can even put a pillow under your head if you're that tight. But you don't need a pillow if you are comfortable on the floor.
Right. If your head hurts here and it's more comfortable with a pillow, simply use that. See if you can get your shoulders back all the way down like this. Some people will be tight, and that will be a little bit of an issue. So we're going to go back, let gravity work. You can bring your arms out here, go up and do those snow angels we talk about. So if you're from the south and you don't have snow, well, then you just imagine. Good imagination.
Like a dirt angel?
Now, one thing that does work well is if you have one of these foam rollers. They come in, this is a 6-inch one. That would probably be good for most people. You can start out with a 4-inch one if you want, but
it is a longer one.
Yeah, 3 foot. You'll definitely want that, not the shorter one, I think is 18 inches. I'm going to put my head on the roller, and it's going to go right up and down my spine. You may want to have a pillow here if that's more comfortable. And Now you could just relax. Now I actually get past neutral, which the floor is neutral, but we're going to get past that for more of a stretch here. Arms out like this. And you may be able to do this and your hands will be suspended because you're tight. Then bring them in like this and gently work it back and forth. Over time they'll stretch and you'll get your arms out. Hands can go down. You might find out one side's tight, this side goes down, this side has 6 inches to go. Then you'll work a little more on that. And then through the whole range of motion, breathe and relax. It should be one of those exercises that's just a gentle stretch. You can get a little aggressive, but don't overdo it. And just relax and hang out for a little bit.
Can you get your hands overhead with your hands touching the back? Oh, you're a little tight there.
I
Yeah,
am
Brad.
tight. Oh,
I got a little more motion than you there.
Yeah. Okay.
All right, your hamstring. Oh, you just you just spit on yourself a little bit there, Brad. You don't want to wipe it off.
Where? Oh
Right
my goodness.
Up top.
Oh.
Anyway, that's a good stretch. If you are even more advanced, you can hold on the dumbbells while doing that. Just little light ones.
Oh.
Only like a couple pounds, nothing crazy.
Yeah.
But
exactly.
actually, yeah, I had worked with a patient recently that had some shoulder issues, didn't have surgery, doing better, and I made him do that. And his painful side was popping up when he went overhead. And he was like, oh. So that's something I actually gave him to work on at home, and he's having fun with it. So.
Oh, Dixie. She said sand angels. So she's probably at the beach.
Oh, maybe.
Beautiful Florida beach and those nice
Dixie,
soft sand down there. That's a good idea.
Dixie asked about wearing a weighted vest while walking. I mean, that's fine as long as it doesn't bother you. It's just going to make your walking harder.
Yeah, as far as shoulder issues,
It's
it's probably not going to be an issue.
I
at
do
all.
have a weighted vest I've worn for workouts, and after a while, it does really depress your upper traps. So you definitely have to build up a tolerance. So if you're going to do a weighted vest, I would start slow.
Right.
And then build up your time because after a while, you get sore.
Do we want to talk about the empty can exercise for that supraspinatus strengthening?
Sure.
So the supraspinatus, that muscle that is related to impingement, the tendon of the supraspinatus is 90% of the time the one that gets impinged. And we want to strengthen that. Your impingement's feeling better. You got range of motion.
It's
right there. And right up here is the muscle belly. Back in here, that's the one we talked about using the massage gun on. I don't have an empty can, but if you have a can, in Wisconsin, if you're over 21, it's going to be a can of beer. Other than that, we're going to use, look at that, empty cup syndrome. So if you're going to empty the cup out, then you go like that, and then go up here to help isolate that supraspinatus muscle. It should be a pain-free range. If you go up to here and it starts to hurt, then stop. Just do 10 repetitions down here. And then the next day, if it feels okay, you might want to go up a little higher. 10 repetitions. Do that no more than 3 times a day.
Sorry, Carolyn was asking about the snow angels.
Oh,
a lot of clicking.
Back to this. Always the snow angels.
As long as your clicking isn't causing pain, that's fine.
Yeah.
You probably just have some dysfunction in your shoulder. If anything causes pain, then you want to back off on how aggressive it is. But otherwise, it's fine.
That's right. So very good. I think that's really the empty can is nothing more than that.
I mean, it's a little harder, but you can also kind of go to the side with it too.
Yeah,
it's a little.
There is controversy on the empty can exercise in the therapy world. So
it is interesting.
You may have a therapist or someone say, "Oh, that's the way they used to do it." So again, I'm not going to emphasize on that one a lot.
Our next one is another good exercise for that person asking earlier about posterior deltoid muscle. You can use numerous types of bands for this. It don't matter, but what I like to do is we just call them pull-aparts. So the thicker the band, the harder it's going to be. With a band like this, the closer you grab it, the more challenging it'll be. The further away, the easier it'll be. And what you're going to do is just pull back. Notice I'm not down here. I'm keeping it straight out in front of me. And then you're going to squeeze your shoulder blades together, keeping your arms straight the entire time. And notice I'm controlling it. I'm not winging around like, oh, I slapped Brad in the face with that. Sorry, Brad.
Be careful. Be careful.
So what you're going to do is try to do 10 to 15 reps. You can do 2 to 3 sets of this, and you're really just strengthening those traps and the post delt a lot. And I really like this exercise. It's really good for posture.
Yeah, it is. You could, wrap it around a stairwell post right there. Anything solid, on the anchor here.
And you can kind of do a reverse fly as well, just like that.
that.
So most people know the fly go in the other direction. This would be a reverse fly. So again, he's strengthening that post delt here. He's strengthening those mid trap muscles there, and it just gets everything going.
I do this as well, so I get a more comprehensive strengthening on that posterior shoulder, where I go out 10 times and I go this way 10 times, and then I go this way 10 times, and you will feel the fibers working more. So that's an option.
There's also one I know called the cheerleader, which is kind of similar to that.
Oh, really?
I don't know. So what you do is you do the pull apart, and then you do a 45.
Yeah.
And then another 45.
Yep.
And you do all that 10 times. So that's one. And then you just go every which motion. If you have a good, healthy shoulder, this is just a good option. If you struggle, this one can be pretty challenging for people.
Right. So I like doing that because it really gets the whole area of the back of the shoulder for posture and for that scapular stability.
Now, the next tip we're going to share is one of Bob's favorites because it helped him a lot when he was having shoulder pain. His was more in his shoulder blade, so in his upper back region. So what he actually found very beneficial was a tip from our friend Rick Olderman. Again, we mentioned him again. Olderman. That's kind of how you spell his last name.
Even though he's not that old.
No. Is actually supporting your arm when you're seated. You can even do it laying down, but we kind of talked about that already. So what you do is take pillows and support your arms to help elevate your scapula up. Brad will show in a normal chair here. If you have a computer chair, you can try just adjusting the armrest up higher, but you want to show how you can do it there?
Yeah, so if you have a chair with stable, solid arms, you simply fold a sleeping pillow in half, squish it in there, and then the weight of your arm is being supported by a nice soft pillow, which is very forgiving, and it takes the weight off of the shoulder and that upper trap where you have that knot back in here. Can make a big difference. If you're working at a computer and you're feeling like you're always reaching up for that keyboard, and that's getting all this tension up here, put it on both sides. See if you can drop the keyboard down so we're here, or raise the chair up so you have support on both arms. You relax and make a big difference. It's one of those little things. And if this really works out well, you say, oh, I wish I knew this a long time ago, and it's consistent for a week or two, and you're going to be working at a computer for a long time, it might be time to invest in a office chair that actually has adjustable armrests so that they're comfortable. And because this is a little, you have to deal with it a little bit.
Morale was asking what equipment we were pulling on now. So we linked it above, Morale. Those are just resistance bands that I was holding. There's 5 in a pack. And Brad had a wall anchor connected to the wall over there,
right?
Which is how he mounted it. But like he said, you can always put it around some stair railing or a railing in your house, or shut it in the door. The kits come with them as well, so you can just shut it in the door frame as a nice option. So
yeah, this is what they look like. You've got this thing, you open the door and close the door, and you can adjust it at different heights, and you'll put the band through the loop, and then you have an anchor that is movable. It works well. It's not as nice as having the wall anchor or something solid in your house.
Sabrina says she has Rice Krispies in her head when she turns her neck side to side. Well, you may have some arthritis or just some tight tendons. However, a lot of these postural exercises we're doing for shoulder relate directly to your neck, because a lot of the muscles attached to your scapula, which is your shoulder blade, connect to your neck. And the tip we were talking about with keeping your arm supported in a chair like that can really help with that as well, just because they're kind of the same system.
Right. Exactly. I was kind of going on to the next one while you were talking.
One, Danny, can you scroll up quick, Danny? No, the other one. The document. Thank you. Oh, we already did that. Okay, we're good. All right, the next tip we have, the next 2 are actually some strengthening exercises you can try, as long as you're not having too much pain with them. A lot of them are pretty safe for most people. The first one is somewhat challenging if you haven't done it before, if you just had shoulder surgery, but it can come with time. And that's actually bringing your arm out to the side with using some form of resistance, whether that's with a band or a dumbbell. So we call these lateral raises. People call them in the gym. In therapy, we call it shoulder abduction. But you can do 2 to 3 sets of 10 to 15 reps with this, and it really strengthens that supraspinatus muscle.
Just a big word of warning. We typically say don't go higher than 90 degrees. This is 90 degrees.
We don't do the overhead ones.
We don't go up in here because it does increase the risk for impingement, and it could actually increase your shoulder pain. So do it in a safe range down here. You can see I've got no resistance here, so I want to adjust that with the band so I have resistance here. And just go up and down in a pain-free range, particularly if you're recovering from a shoulder injury. Again, the dumbbells work well. Again, keep it in here. That's lateral abduction. You may want to work flexion straight out in front of you.
You can also do it with handles.
Oh, there you go.
Or
Look
if
at
you
that.
have a cable machine at your gym, you can do them this way too. I kind of like this version at the gym because it makes you go across your body more. And
Sure.
it gets a little bit more muscle fiber.
Yep.
So I like going out. I find this more challenging because the dumbbells, you just whack your side here so you don't have that full range. And our last strengthening tip is actually working on shoulder internal and external rotation. And every time I do this with patients, they say, when am I going to use this motion? And I tell them, you actually do it quite frequently when you're just moving your shoulder around.
This is specifically for the rotator cuff muscles to help keep the ball of the humerus into the socket in a stable manner so that you do not get that impingement. You have a healthy rotator cuff movement. Mike is going to demonstrate how you
people cheat with it. So what we do is we use a towel. So what you want to do is keep your elbow tight to your side, and all it is rotating out and then rotating back in. So what most people do is they get weak and they use their triceps, so they end up doing this. So with a towel here, you can't cheat because if you do that, it falls out. So we're going to keep a towel under your armpit, just a small towel, not a huge bath towel. And you're going to rotate out first. So you have to face this way and just work on rotating like this. I like to make people rotate up because otherwise, again, people can kind of cheat and just straighten their elbow like this. Mm-hmm. So I rotate up and then I go back. Most people are pretty weak. We don't strengthen this muscle a lot. So just do 10 to 15 reps, 2 to 3 sets of this. And to go the other direction, you have to turn around. Most people are a lot stronger going in. You can't see what I'm doing, so I will switch arms. And most people going in is a lot easier than going out. So you just work on your internal rotation like this.
Can you do the external rotation again with the towel and show what happens if you do it wrong? That's why
I kind of did earlier, but yeah, if you start cheating, it'll just flop out. Yeah. So you have to keep your arm into your side like this. If you can do this safely without any issues, actually it's a little more bothersome. I kind of like the towel in there. It gaps your shoulder a little bit.
Yep.
So yeah, you can just do this. You can do one arm like this. If you are coordinated enough and you have 2 towels, you could certainly do it like this and just do both at the same time.
And you can do this with a weight or a dumbbell and lie on your side. Like here, have a pillow for your head, works best. And then your elbow actually just rests on your side and your hand goes right down by your belly button and you come up, but not this. The elbow stays still and we rotate up. This is very common, particularly after a surgery when those little muscles are very weak. Actually, just doing this without a weight is how they start, something like that. And then I've had a lot of people just say, take a soup can, 12, 16 ounce, and start with that if you don't have a dumbbell. And that can be a big difference there. And it works well to get you going in the right path. And then, increase. This is one of those things that you're never going to go up to 10 or 15 pounds. For the vast majority of people, just a lightweight.
This live, someone was asking, will the live be posted as a video? Once we're done, this live stays on as a video, and you can rewatch it as many times as you want. If you're on YouTube, it'll just be under the live section. Mm-hmm. It won't be under the normal video section, but it'll still be on there. You can also rewind it while you're watching live, too, if you want. You can just scroll. On Facebook, if you're on there, it will disappear after a while, but it stays on YouTube long term. Julie did have a question about her neck. We're not specifically addressing neck in this video because we're talking about shoulder, but a lot of these tips we did like the wall slides we showed earlier, sliding up and down the wall, or a tabletop can help. The chair support with a pillow can really help with that. Just some of these general shoulder stretches and strengthening exercises can help as well. The one behind the back, any of these, because a lot of those muscles correlate between the two. So
That's right. I do want to say that I think we're getting near the end.
we are. Someone said the labral tear. We're just gonna go through the questions. We already hit the 20 tips. Again, next week we'll be live at 10 a.m. on Tuesday Central Time Zone. We are talking about foot pain issues next week, but there is a question from Samuel. It says, I have labral tears in both shoulders. Are they safe for me to do? I'm desperate to avoid surgery. My doctor is recommending it. A lot of people I've worked with labrum tears, if it hurts with whatever exercise, it doesn't get better with the same exercise, unfortunately. Like rotator cuff partial tears, sometimes just strengthening and stretching can help, and they don't need surgery. But oftentimes when it comes to labrum, that we can't really repair labrum through exercise. You can certainly strengthen your shoulder before surgery because you're going to recoup faster after, and keeping your range of motion is very important. But most people, if they have a small labral tear, they can tolerate it. If they have a big one, or if you injure it again, it's going to just keep tearing more and more. So oftentimes, yeah, unfortunate with labral tears, you probably going to need to have surgery eventually.
Yeah, and actually, last time I did some research on labral tears, it's less and less surgery because it's not easy to go in there and stitch the labrum together, so the results aren't really strong. So talk to your surgeon about that after they do the MRI scan. And it is one of those things that kind of an individual thing. But I have a friend like Chris who's got a labral tear and he's got bad arthritis. And actually, they told him, you're going to need a new shoulder. And he said, I don't think so. So he went and got a second opinion. He did have some work on it. He's working through it and he's being successful so far. So it's one of those things you really have to learn how to work with your shoulder, especially with those labral tears and some of these shoulders that are just kind of abused and beat up in the past. So you really need to behave and do the right thing. Hard to give us personal, individual attention over the internet for that.
Yeah, I actually work with a physical therapist who had a labral tear, dealt with it for a long time, was doing fine. But unfortunately, he fell off a four-wheeler in the fall and just tore it all the way around now. So he had to have surgery. The good news is labral tear recovery is usually a lot quicker than a rotator tear recovery if you have surgery. Typically you can advance a lot quicker, but any of these tips really help if you're doing them ahead of time. It's the people that have really poor motion and wait to get shoulder surgery for 5 years that really struggle, and it takes a long time to get their motion back.
All right. So very good. It's been an excellent, it's been an hour already. We've been explaining and trying to answer questions. I wish we could answer more questions. We are limited because we're just going over time.
You might recognize that guy. You want to wave, Bob? You're on camera.
You're on candid camera.
Bob's here. We just call him in and video chat him. So everyone say hi to Bob.
There you go.
There's TikTok. You can say hi to Bob as well. He's got his director hat on today.
I'm going to start spinning these ways because this is fun for me. Don't do this at home. Anyways.
Do as we say, not as we do.
Yeah, once again, going back to the olden days, we can fix just about anything except for
a broken heart and probably a labral tear.
Right.
Mainly broken heart.
Yeah, we're working on that as well. It's been a long, grueling effort, but we will not give up. Be careful and have fun.
And thank you for watching.